Support comes from Goethe Pop-Up Seattle, presenting 55 Voices for Democracy, a podcast that brings together conversations with intellectuals, artists, and activists. Inspired by Thomas Mann's speeches produced for the BBC during the rise of fascism in Europe. Available on Apple Podcast and Spotify.
Hey, it's Patricia Murphy. It's Wednesday, and this is Seattle Now. Just how bad is the pandemic right now? Bad enough that epidemiologist Judith Malmgren has stopped going to the grocery store. In a minute, she'll break down the COVID numbers for us and explain why this wave is worse than the last two. But first, let's get you caught up. It's going to be a Zoom Christmas. Governor Inslee extended the state's COVID restrictions until January 4th. The 3-week extension will keep gyms, bowling alleys, and museums shuttered over the holidays. Indoor dining also not allowed. Inslee pledged $50 million for the hardest hit businesses. Seattle's public schools could reopen for some in-person learning as soon as next March. Superintendent Denise Juneau wants schools to prepare to admit special ed students and pre-K through second grade. The school board could vote on Juneau's plan as early as next week. Juneau also announced she'll stand down from the job when her contract expires next summer. And Boeing's 737 MAX is back in the sky. Brazilian airline KUOW is scheduled to fly passengers on its MAX planes starting today. It's the first time the aircraft will carry paying customers since March 2019. American Airlines is expected to be the first U.S. carrier to use the jet on December 29th. The MAX received federal clearance to fly again last month. It's been about a year since the first COVID-19 outbreak in Wuhan, China. And here in the U.S., the pandemic is at its worst point so far. Judith Malmgren is here to help us sort through all the numbers and help us make sense of where we're at. She's an epidemiologist at the University of Washington. Hey, Judith, good to talk to you again.
Good morning. Nice to be here.
We've all seen the numbers, and the headlines are just downright scary, but it can really feel overwhelming. So cut through all of this for us. What is your assessment of where we are right now in this pandemic?
Well, Trish, it looks like we went to hell in a handbasket. I wish I could say something nicer, but the rate per 100,000 is over our top marker on the color chart on the DOH, Washington State DOH website. It only goes to 75 or more per 100,000. We're way past that. We're at 436 per 100,000 for statewide, and some counties are more and some counties are less. I think that everybody thought that the phased opening and tracking and tracing and testing and masking recommendations would work. And the virus got around all of it.
So you have been looking at this since the beginning. You and I have been talking for a long time throughout this. Did you ever think we would get to this point?
Nope, I didn't.
Really? Wow.
I thought we would get to 100, 150 per 100,000. I didn't think we'd get to 436. I thought that it would probably stay more in the urban areas along the I-5 corridor, but it spread to every corner of Washington state.
Wow. Okay, so no area of the state is doing even moderately well right now. The last time we talked, you were still comfortable going to the grocery store and going to Costco. You even decided to eat your takeout inside a restaurant because it was empty at the time. Has anything changed for you?
Oh, yeah. Yeah, everything is being ordered online, pretty much.
So you're back inside.
We're back inside. I do have a very nice setup. I bought a tent, one of those canopy things with a little fire pit place, the gas fireplace, and a patio heater. I got the last one, I think, and we set things up outside so we can have a visit, an outdoor masked visit.
But you're pretty much hunkering down at this point.
Yes, I am. I don't think there's any place where you could think you could go and be safe. I wouldn't feel, I think everything right now has risk.
Wow. That makes me honestly very worried for the people who have to go out and do their jobs.
Yes.
Who have to be inside a restaurant or doing deliveries.
Yes. I think it's very worrisome for them when we're looking at people working in hospitals, frontline workers. I'm just hoping that vaccine gets here as soon as possible to get them vaccinated. Our frontline workers with the state, our CDC officers who investigate outbreaks, I want them to be vaccinated as soon as possible. I want them to be safe because their job is so very important. Then I believe it's nursing homes for sure is next. And then once we get past that, it'll be another ball game of trying to figure out who's going to get vaccinated once we get adequate vaccine supplies.
Yeah. Yeah. Judith, we have been through a couple of waves of this pandemic. Why is this one different?
It's not a wave anymore. It's everywhere. It's alarming. It's certainly alarming. But I think you just have to absolutely minimize any time you go outside, even if you are a safe person and you're wearing your mask and you're taking care of it. I think we just have to reduce the number of people that are outside of their homes.
Okay. Since the pandemic, we have learned a lot about our health system and how it responds to crises. What have we learned, and what do you see needing to change?
I think we're doing an excellent job of treating people. The problem is, how are we treating our medical personnel? Are they getting tested regularly? Do they have enough PPE? And how are we treating burnout? And they have PTSD. They are in a war zone.
This is a huge concern, burnout of medical personnel at this point, because they've been doing this as long as we've been doing it.
Yes.
On the front lines.
Yes, they are in a very difficult situation, crises every single minute of the day, and where you're worried if you're going to have enough PPE. Are you exposed? Did you get all your clothes on exactly right? Did you get everything covered when you went in that room? When you go home at night, are you remembering to take off all your clothes, throw them on the porch or whatever you have to do, and go in the house naked so you don't expose your loved ones? It is so hard when you know that you're being exposed to a potentially deadly disease. It's a very, very difficult situation for them. We are losing people in the public health departments in the individual counties for a variety of reasons, some of them political and other ones just burned out. And we never had staffing at the level that we need for this. We didn't have the data system set up to handle this many cases. It's incredible the job that they have done with absolutely no warning and no infrastructure. I mean, the infrastructure is meant for like the flu or, E. coli outbreak from bad lettuce or food poisoning. It's not set up for a massive pandemic.
Yeah, of a highly contagious disease.
A highly contagious disease, yeah.
Judith, talk to me about the next few months. What should people prepare for? So
between now and January 15th, as much as humanly possible, stay home, stay away from people. It's not going to be pretty, but it's not forever. And that's what gives me hope and makes me feel better, that I can do this till April, till the weather gets better, and hopefully we have more vaccinations.
Judith, this is such a hard time to dial it back and stay inside. The holidays are the time when we like to get together with each other, and people have already been doing this through Thanksgiving, even though it seems like maybe some people didn't do such a good job distancing.
Yeah, I think that's clear. They didn't.
People are really excited about this vaccine, but I am hearing about supply chain issues.
Yeah.
How should we be thinking about this vaccine?
Well, we're going to look forward to it, that's for sure. We were all vaccinated as children. We lined up, because I'm a little older, but we lined up and we got shots in the arm for polio, for measles, mumps, and rubella, and we pretty much eliminated those diseases. If we can do that with COVID, well, hallelujah, I'm so happy. It is a miracle that we have the science and the personnel and the expertise that we were able to come up with a vaccine. This is such a big deal. Because think about the alternative. In the worst case scenario, this could double in the next 2 weeks.
Oh, my gosh.
It's absolutely a possibility. I hope it doesn't happen. I hope things start to level off. We've done it before. We flattened the curve in Washington State, but it's a lot harder now, and that's why I'm emphasizing staying home and staying away from people, because it's much more widespread. We had a lot of pockets before where there wasn't disease. Many counties did not have any cases. Now it's the whole state. There's nowhere to hide.
Well, we should hunker down for a tough holiday season, Judith Malmgren, and stay grateful and thankful maybe for the little things that we have during this time.
Absolutely. Just savor those small things that make you happy. Listen to some music that takes your mind off of it and brings back good memories of Christmas past that will come again.
Judith Malmgren is an epidemiologist at the University of Washington. Judith, really appreciate your time. Thank you.
It's been my pleasure.
Thanks for listening to Seattle Now. The show is produced by Clare McGrane, Sophie Reed, Caroline Chamberlain Gomez, and Jason Pagano. Matt Jorgensen does our music. I'm Patricia Murphy. See you tomorrow.